My name is Jetlag, and I'm just back from the IFS in Vancouver. Oh, just play Debra Betts, and I'll see you in Rothenburg.
Oh, baloney. The whole thing always gets back to drugs.
Ask you that. I've a few questions that come up in the clinic all the time, and I just put them here just so that I know to make sure that I would ask them to you, because then I can put it in the vlog and then just show it to everyone. So you do know that the most common question in the clinic is not just from patients, but actually from other clinicians as well. Acupuncture during pregnancy, is it safe?
Yeah, that's the question that got me into doing my research in my PhD, because of course it has to be safe, and that's of course the midwives and the obstetricians. That's the first question that they're going to ask as well, and they don't want to refer to something that might have any potential risks. Absolutely. So, there's been quite a lot of research on pregnancy and the use of acupuncture now, and I should say that it's really, while it wasn't when I started, it wasn't very common in New Zealand. It was in countries like Germany, where they teach it to midwives. And so there's a lot of research coming from Europe where midwives have been using it in hospitals for a long period of time. So all of the research may come out wherever you've got a control group. It is ways that yes, sadly, things happen in pregnancy. So people do miscarry and premature labour. But there's never been any study that showed that there was a greater occurrence in the acupuncture group compared to the control group. So although the research might come out with different findings, and we could have a discussion around, why that might be, and the interventions used by some researchers versus what we would use in clinical practice, and whether we think the interventions they used are even reliable. The bottom call that we can take from all of this research is that when you have control groups, there is no greater risk. And there's now a couple of systematic reviews that have been published, particularly on the safety, and they all conclude that at the moment that there is not a problem with this. So I think special care is needed, but there's, the safety aspect is quite clear.
So personally, and Siobhan even more so than I, sees even way more pregnancies in the clinic, whereas for me, just the way that the last few years have gone, I've gone to actually more gynecology, PCOS, and then actually the trying to get pregnant. But I still find it really, really rewarding. Like, it's one of those things that I really enjoy treating during pregnancy, at any stage of pregnancy, especially then as you're preparing for labor, and then you get pictures of the happy mom and the happy baby and everything. But apart from me really enjoying it, another one of the questions that comes up a lot is, so acupuncture during pregnancy, is it only for when things go wrong?
So it depends what you mean by that, in terms of a lot of women will, as I was saying, will put up with things that they're told are quite normal. So pain, the headaches, the heartburn, and that isn't normal. Just because a lot of people suffer from this doesn't mean that it's a normal part of pregnancy. So I would say any complaints that you have from an acupuncture point of view, you can often help the body work better, and so that you can reduce the inflammation and the stress and the effects on the body to make women more comfortable and enjoy their pregnancy more. So yes, you have the nausea and you have the breach, and you have things when things are really not well, as well as the minor problems that women tend to put up with and think no one can help them with. But really the strength that the midwives really like is the preventative aspect. So that idea of preparing for childbirth, ripening your cervix, dealing with any hormonal issues, really putting your body in the best possible state so that when you go into labour, things go well. And it's very clear here in New Zealand, because we have what we call lead maternity caregivers. So these are midwives who are in charge of the birth, and they will refer out if there are problems that need a referral to an obstetrician. But happens is every 2 years they have to go before a panel and they look at these statistics of normal vaginal birth or interventions and problems that happened. So they keep track, and that's what I mean by the positive feedback that was coming back to me, was that it was really increasing. It was halving their intervention rates. So they, just through doing, 3 or 4 treatments in the weeks leading up to delivery, they're allowing women to go in and start off having, the best delivery they could have, sort of the most efficient labour, and finding that they weren't getting the problems that they would usually encounter. So, yeah, I think that's a real strength, is
I'm asking in that point of view, because you do get a lot of I don't know, that they sound like basic questions, but I just want to cover them, just again, even to have them. As I said, there's a lot of patients that do watch the vlogs as well, and it's something that normally comes up, which is one aspect, as you said. Yeah, sometimes women just think that it's normal, and everybody, or most people who they know have those problems, so they just take it as, well, it's just a pregnancy thing. And then they think that, well, does this warrant to go and look for treatment, and what treatments are out there that are available that I can avail of?
Yeah, so what I encourage practitioners to do is go and talk at antenatal groups, or, just to tell people that there is, if they're interested, there are things that they can do in terms of those problems. I think one of the exploring at the moment that I think is underestimated by a woman is the postnatal care and postnatal recovery, and what we have to offer there. And that's something we've been exploring in these workshops in Sydney and Melbourne, and I will be doing in Vancouver as well, is just that the feedback from the midwives, because they are seeing these women at these times, and that the small interventions that they can do then, the dramatic healing from caesarean section scars with moxibustion, the dramatic increases in milk supply. There's some things around what's, called sort of urinary leakage, bladder leakage in pregnancy, which is kind of another thing that people are told is normal. They'll go away in postpartum, but it doesn't always. And the positive things that we can do to help the body in that 6-week recovery postpartum, instead of waiting until the problem has stayed and you're now 8 weeks and you're exhausted and the milk supply is not good and you're getting mastitis and you just feel really tired and exhausted. So this idea of intervention at 2 or 3 weeks postpartum, a small amount of intervention, and the positive effect that seems to be having. So that's another, I would like people to know about.
Yeah, that is a very good point. And tell me, one of the things that just coming to my mind now, just leaving the questions aside now for a moment, one of the things that you talk about a lot, either in public, as I've been at a lot of your talks, and even when we're talking as practitioners, is auditing the clinics. I can see now from what you are saying how important that would be as well, because the more information we have to show, and showing what we are doing and what is happening when we do it, that is very, very important. Does this happen there in New Zealand? Do you see it? Do you see it in Australia as well, since you are teaching there back and forth? Is there a change in that?
Not yet. I'm trying to talk to practitioners about keeping. I think if you read the articles that I've written from the hospital clinic, is partly because we also have to prepare reports within the hospital to go to the Minister of Health, etc. It's part of what is happening in the hospital. So it's really just about seeing who's coming in for treatment, what you're servicing, what the demand is there for. Those things can be terribly important, so practitioners can, find out what their practice is actually consisting on and who they're not reaching, as well as what their outcomes are. So I think it's just a matter of being a health practitioner and being aware of what service you're offering.
Yeah, I think
I hope we've got electronic programs.
Yeah.
In the old days, I had to go back through my notes and do retrospective audits, which are not very desirable. But now that I know a little bit more, and now you've got electronic programs, so we're moving forward and where it'll be much easier for practitioners to do reflective practice and find out what's happening in their practice. Yeah.
I think that one of the things that I do find still with practitioners is that you kind of see that. So I see it with different eyes now, 2.5, almost 3 years, 2.5 years into the doing my master's on the importance of having, a structure and stuff written down and whatever, that I thought it was just for other people. It's a bit like, why are you auditing the clinic? You're only giving information away. But it's that bit that we're missing is that, we're going to benefit from that information as well. So yeah, you are in a way, you could be passing it away, but that's going to be really important for you as a practitioner because it's your field, it's your area of practice, and you're also informing the profession and trying to, as you said, you might even identify gaps as well.
And I think it's just part of that reflective practice. So it's impossible to kind of have a good overview of your clinic from your memory, because we all do this. We all remember the patients that had the fantastic successes, threw away their crutches and walked out the door, and you might remember the very difficult cases, but to actually get a realistic picture of what's happening in your clinic is you need to really look at who did back, how many treatments people came for, keeping records of what we call adverse events, minor ones like, people who might have a bit of bruising or needle pain, so that you can improve practice as well. So I think all of those come into and any potential problems that you might identify. As I said, in my practice, we haven't identified that there have been any problems with doing acupuncture. But you still need to keep that in mind and be examining that.
You probably I'll go back to the questions, because there's one particular question that you are arguably, you are the best person in the world to answer this question, because you have your experience and you also know, and you've
now
lectured.
I'm worried. What sort of question did you ask me?
Not that one that you're thinking about. I'm just saying that you've trained a lot of people. A lot of us, when I started in studying, your book was already something that I wanted to get and I wanted to read. I know I'm going to ask you to talk about conditions, but it's the same thing again, just for people to hear from your experience and from what you're seeing when you go and lecture and when you go abroad. What are the most common conditions that we are now, either we are really well equipped to deal with, or the ones that we are really seeing more, or that the midwives are seeing more? What is your experience of the clinic if someone does acupuncture during pregnancy? What are we seeing the most, and what are we being most effective in treating?
So that's easy to answer, because we keep records of what we've been doing at the hospital clinic. And in my own private practice, I kept records as well. Definitely back pain. So pelvic pain is, a good 50% of practice, if not, it's sometimes higher. And that is really important, because many the research around that is quality research that's done with physio as a control or usual care, finding that acupuncture is actually recommended. So we have some really good literature there from high quality studies and reviews, a Cochrane review, which is supposed to be the gold standard, saying they recommend acupuncture. And what we have is physios. This was a lot of physios delivering acupuncture as well, who are worried and concerned about pregnancy and not delivering. So when they survey physios, only a third of physios who use acupuncture want to use it in pregnancy. So I think that's a really big gap, and that acupuncturists can come forward and treat these women who are suffering terribly with, this back and pelvic pain. So that's definitely out there as a number one treatment. The other thing that comes through is the preparation for labour treatment, the righting the cervix, the balancing the hormones, the helping the baby into a good position. So from a midwifery perspective, you're helping they can see physical changes in the body that are really beneficial and lead on to more effective labours, especially for women having their first time babies or women who have problems in a previous delivery. So those would be the two main ones that come up consistently. Around that, there are a lot of, the most common thing we treat when women actually come in on their first visit, which would be a secondary symptom, would be the heartburn and vulval varices and varicose veins. So these are things women don't really think about acupuncture for, but we treat them in the clinic. So those would be the most common, but there's a high incidence of things like anxiety and depression, just people not coping, feeling overwhelmed, not sleeping well. And the midwives we're getting increasing referrals for people who are also under care under another practitioner, their GP or their obstetrician or the clinic, the at-risk clinic, and they're on medication, etc. But we're supporting them as part of that to help reduce that. I think for me, there are I could just go on and on. There's a whole lot of conditions that are so interesting, like the gestational diabetes, like early problems with blood pressure, that the midwives feel and send people because it feels like you help those not develop into such serious conditions, but we don't have the research to claim that or prove that. It just seems to be a feeling that beneficial for women to have those treatments, and they appear to stay normalized. Anemia is a big one.
Right, okay.
Because you've got blood tests. Same with the preeclampsia. This is mild conditions where your blood pressure is a little bit strange, and you've had some blood tests, and they're not severe yet, but they're not quite as normal as people would like. And what happens after the acupuncture treatment is that they can see an improvement. So you've got something measurable, and
it's
also
easy
with
to measure, isn't it? Like it's easy enough to measure.
And with and it should be measured because it's really important to keep track. It's a very dangerous condition, pregnancy. So you need to have monitoring, and the monitoring shows, hey, this seems to be under control, and so that's really useful. And then also with the anemia, you've got hemoglobin and ferritin levels, which with the treatment, which is actually around moxibustion, which is this, not so much needles, but having heat applied to the points, that again is measurable and getting far better outcomes than the midwives expect by dietary formulas alone. And ferritin is your stored iron. So there's something about the treatment that allows your body to store the iron in that a little bit more effectively than if it doesn't have that help. So those things I think are really interesting and huge potential.
Oh, baloney. The whole thing always gets back to drugs.